And that brought me back to Chennai after my retirement, in spite of my friends saying that, Delhi is a better place for post-retirement. Be that as it may, after I came to Chennai for my post-retirement life, I came to know of Dr. C.V. Krishnaswamy. Although I have seen him from a distance earlier, I came in close contact with him, both for personal reasons, in the sense my family members, and also because of his interest and attachment to Carnatic music. I knew his father probably more than probably I know him, because his father was the department counsel for the income tax department, and he used to be the prosecution counsel for various tax evaders against tax evaders. And at that time, I've gone to their house many times. But the human side of Dr. C.V. Krishnaswamy is something which need to be stressed. I think if he has been treating the elite of Madras and the elite of Mylapore, I think the credit goes to him, because he has been so warm and friendly. I think doctors should learn initial lessons from him on this. With these words, may I say thank you very much for giving me this opportunity. Mr. Karthikeyan was just mentioning that we should pay something to such institutions which do public service. In fact, the founder of Dr. Sanjeevi's father-in-law used to know him, Dr. Ramakrishnan. He used to tell me, when I was probably a young kid of 19 years, he used to tell me, Krishnamurti, God has determined when a child is born, so much of food should be eaten by him in his life. The less you eat, the longer you live. That's what he used to tell me. So I think these doctors, particularly I would say the doctors of a new generation, not of the age, new generation in the sense new kind of treatment, they should do well, and I would strongly urge that we must encourage as members of the civil society. I have great honor in giving a small donation to the tax center. Thank you. May I say thank you for giving me this opportunity. May God bless you all. Thank you.
Thank you, sir. We request Professor Suresh and Professor Hegde to present a memento to Mr. Krishnamurti. Thank you. We call on Dr. Ramesh Chandrasekharan to introduce our guest orator, Dr. Chris Reynolds.
It gives me great pleasure to introduce Dr. Chris Reynolds. Dr. Reynolds graduated, got his MBBS from the University of Western Australia in 1973. He spent most of his professional career as a general practitioner in Perth and Melbourne. He's also worked for the International Organization for Migration, assisting resettlement of Vietnamese and refugees in Hong Kong, followed by a year in Moscow, assisting resettlement of Russian Jewish migrants to the United States. In 1995, the chance healing phenomenon using a cereal grass extract reignited his flagging passion for practicing medicine. Since then, he has used wheatgrass to help thousands of his patients overcome conditions for which there was no satisfactory pharmaceutical alternatives. He now leads the world in his clinical experience, scientific knowledge on understanding how wheatgrass and other cereal grasses have such beneficial effects. We welcome you, sir, to the dais.
Thank you, Dr. Ramesh. Dr. Chris Reynolds, the organization would like to honor you first with a medallion before you start your oration. Can we just request Mr. Karthikeyan and Mr. Krishnamurti to do the honors of presenting a medallion, a plaque. We also would like to present him with a Ganesha statue as well as a book on temples of South India to make sure he comes back to visit us again. Can we have you all there together for a photo op, please? Yes. We request the other dignitaries to take their seat in the audience. And we have great pleasure in requesting Dr. Chris Reynolds to deliver the TAG VHS DRC second annual day oration.
Sorry about the technical glitch, but that's life. Well, my name's Chris Reynolds, and I've spent most of my 40 years in medicine as a GP. And, I'm from Australia. It's a place where there used to be a test cricket team, but last I heard it had suffered a sudden demise somewhere in India. Fortunately, I didn't get to Chennai 3 weeks ago. First, I'd like to take this opportunity to express my sincere thanks to Dr. Krishnaswamy and Dr. Hegde and the TAG VHS Diabetic Research Centre for giving me the opportunity to talk about my life's passion, wheatgrass. I'd also like to say that I am completely, I can't believe the reception that I've received. I'm surrounded by heavyweights. I'm just a GP, and something like this would never happen in my country. In fact, I've been working with wheatgrass for 18 years now, trying to encourage my colleagues to at least listen to me, but I've never succeeded. That probably doesn't say much for wheatgrass or what I've achieved, but it seems that everyone else around the world is interested except my own countrymen. My tour of the centre yesterday was an unforgettable experience, and I think that everything was said about Dr. CVK and Dr. Hegde tonight is completely my view and my impression of what incredible human beings they are. You know, I felt surrounded by like-minded people, and my basic philosophy in medicine has always been the first thing to do is engage your patient. And once you've got that, you've got over the major hump. And then you start thinking about medicine. And I also think their selfless approach to, and their genuine approach to patients and trying to help them and forgetting about the clock and forgetting about the money, but doing the things that we're supposed to do as doctors, I think is the most important thing. And also, my philosophy in medicine has always been do no harm, and I learnt that when I was very young, and I've stuck with it. And that's why the wheatgrass, when it came along, because it was so harmless, I found extremely attractive. So I'm now going to attempt to condense 18 years of working with wheatgrass into 30 minutes. So if you'll bear with me, if I can get the next slide, I think I'm... Oh, I've got it. There we are. Right then. You can have the bag, thanks. Well, let's take a brief look at how we make our wheatgrass extract. I actually have left medicine and set up a company because wheatgrass was helping so many of my patients. Thanks. No, I don't want that. Just one of those days, I guess. These things happen. And I set up this company, it was 11 years ago now. And I sort of ran this after work. I'd come home at 7 o'clock at night and then work all night researching, studying, not just wheatgrass, but the cereal grasses themselves. And we gradually got things going and got some products together. And I'll talk to you about a little bit about what we use. But how we actually make the wheatgrass, it's quite simple. We take seed, we put it in a tray, it grows, and we cut it. So it's a fairly complex procedure, as you can see. And I think Indians have been doing that for thousands of years. Nothing new.
Very simple.
Very simple. That's right. Even I can do it. In fact, I did a lot of it. I did it for years. I tried many different seeds, many different cereals, and eventually I ended up with wheatgrass as the preferred. It was a matter of trying it on, basically thousands of different patients with different conditions. So we cropped this at about 14 or 10 to 14 days before the actual grass starts to joint, because at that jointing point is where there is the maximum bioactivity of the plant itself before it joints and starts to form the seed. It's also a gluten-free point, so it's very important for a lot of people who are sensitive to gluten. We then it's a bit hard to talk with, isn't it? We then juice it. We process it for about 3 or 4 months, and then we store it, and then it goes into our products. So it's a very simple process, but it's helped a lot of people, and a long time before I came along. Now, I should point out that these... Oh, thanks. Thank you. How's that? Can you hear that? I should point out that the cereal grasses, wheat, oats, barley, rye, etc., all have similar healing properties. So when I talk about wheatgrass or cereal grasses for the purpose of this talk, they're essentially interchangeable. Now this slide gives some idea of the clinical studies, or some of the clinical studies from the 1930s to the present day, that demonstrate the remarkable broad spectrum of cereal grass bioactivity. It goes back a long way, but most of it is forgotten science, and there are reasons for that. Main reason being that wheatgrass was used in the hospitals mainly for treating suppurative wounds, and it cleaned them out virtually overnight. It was extraordinary. And so then penicillin came along, and that was they decided it was easier to give somebody an injection or a capsule than it was to pull out a juicer in the battlefield and start feeding it to or putting it on people's wounds. And it actually began in hospitals in the United States when it was discovered that it had other properties too, wound healing properties and various other things. And some of these studies were really quite extraordinary. One of them was they used to treat acute sinusitis, because in those days it was a potentially lethal disease, not like today where we do have, can I say the word, antibiotics, which does actually clear it up. But they used to take the pulp from the wheatgrass and stuff it up into people's noses, up the back of their nose, and it actually cleared up this condition because it cleared up the pus, and it was an anti-inflammatory effects, and these people, there were 1,000 people in one study, and they all got better. And these were senior surgeons and physicians that were actually doing these studies. Most of them were case studies. There's not many double-blind trials were done, but anyway, it's still indicative of what it can do. In 1988, a scientist called Chernomorski showed through in vitro studies that a cereal grass derivative dramatically increased the rate at which cells grew and developed. And also the effect occurred in many different cell types, including heart, skin and nerve cells. And it was clear that these derivatives acted as a growth factor that influenced mammalian cell growth. And then it was about 52 years before that, a man called Kohler, who was actually an agricultural scientist, he discovered that it was evident there are important water-soluble substances in cereal grass juices that directly stimulate growth. He was working on animals, rabbits and guinea pigs, etc. But he demonstrated this by adding cereal grass sprouts to animal diets, which dramatically increased their growth and fertility rates. And the grass juice factor, as Kohler called it, was found to be widespread in nature, but is at its highest concentration in cereal grasses. Although it was isolated in numerous experiments, the factor has never been identified. Nevertheless, cereal grass research, both in vitro and in vivo, continues. I've reviewed a substantial segment of the literature and used wheatgrass extract successfully in many thousands of patients since 1995. And clearly it displays a broad spectrum of biological activity. As a GP, you see this, and I think I was in a better position as a GP to to get a hold of what it's actually doing, because we see everything. And, you know, if you're in a specialist area, you're probably limited in that sense. But we see right across the spectrum of illness. And so that's basically it. As I said, it's essentially a growth factor, fertility factor, widespread in nature. It occurs in many green and non-green plants. It's very high in green peas, for instance. Though they found it in hundreds of different vegetables and plants. And but the highest concentration of all was actually in cereal grasses. Now, although modulation of cellular immunity is an in vitro finding, as we got here under the lab studies and patient laboratory results, we're looking at the effects of wheatgrass in mammals and its potential as a therapeutic agent. One does develop in time a strong sense that immune modulation is occurring. You see, I don't know, you see ups and downs, but you see levelling out of various clinical conditions. And it seems to normalise pathology. I know this might sound very strange to you, but this is what happens, and I'll be demonstrating that shortly. And numerous, with the hematological parameters, there are numerous studies show bone marrow stimulation in vitro, and laboratory tests in patients attest to often quite marked improvement in blood element status. Dr. Mawahar, who's a paediatric haematologist in Chandigarh, with whom I've communicated on several occasions, for instance, demonstrated significant reduction in transfusion requirements in children with beta thalassemia when they consume freshly juiced wheatgrass every day. He's got about 400 patients on his list, which is pretty big. We don't see thalassemia in Australia very much. Effective cancer cell apoptosis has been clearly demonstrated in a number of studies. Other studies indicate direct effects by cereal grasses on the pituitary gland. The clinical studies mainly include responses to inflammation, hemostasis, hemolysis modification, and tissue recovery. And they provide some idea of the remarkable broad spectrum of bioactivity expressed by wheatgrass. Well, that may go some way to explaining the systemic effects of cereal grasses. Some way. I don't say that is it, but that is the way that I see things. But what about the topical and local effects such as pain relief, anti-inflammatory effects, and tissue healing? Sorry, I missed out on that slide there, but this is my basic theory, and when I have that theory in the back of my mind, things seem to make more sense when I see things, sort of phenomena that I see with the healing, and but that's what I feel is that this the growth hormone. We know that the growth hormone is stimulated by the cereal grasses, prolactin, etc. And growth hormone activating IGF-1 possibly influences gene expression. Yeah, I'm having problems here. So over the past 18 years, I've seen numerous instances where wheatgrass improved medical conditions for which no pharmaceuticals were available, or where the potential adverse effects of drugs deterred their use. An example of where no pharmaceuticals were available was, for instance, in treating molluscum contagiosum. But we'll start with this one first. For instance, the last time I prescribed acyclovir for a patient, I nearly killed him. He commenced the medication in the morning, and by the afternoon he was in intensive care with severe Stevens-Johnson syndrome. Since then, naturally, I've been very wary about ever using it again. And I've only used wheatgrass for shingles since then, which not only works for this condition, but has a side effect potential close to zero. This slide shows two examples of how effective wheatgrass can be. And the gentleman at the top, a new patient, had been in severe pain for 4 days. And clearly his rash looks quite nasty and about to break down. And he's got pus forming here, he's got this inflamed tissue, and he was in a hell of a lot of pain. What do you do for people with pain, with zoster pain? Give them narcotics? I don't know. That's not good enough sometimes. So I sprayed the rash with wheatgrass extract and got him to apply it every 4 hours. And a couple of days later, he was completely pain-free. His rash has now started to dry up. You can see it there. The pus is gone. The rash is gone. The inflammation is settling down, and he was fine after that. Now, I'm not only talking about him. I'm talking about hundreds of patients that I've treated with herpes zoster. It works. And it's not me. And people say it's a placebo effect, but I think, well, yeah, but I've seen a very broad cross-section of different conditions respond to this. External application, yep. No, just put it on the skin. Yep. It's like many other, there are other cases that I think that we'll probably build on that, but it just works. And my father had severe shingles once and nearly wiped him out, and I wish I had had that at the time, because the pain that he went through was extreme. So how can this be explained? Well, we know that wheatgrass, it's been shown in vitro studies anyway, that wheatgrass displays COX-1 and COX-2 inhibition. It also contains apigenin, which is a natural anti-inflammatory agent, and other studies suggest there may be a substance P inhibition effect at work. So, molluscum contagiosum, this is this mother, as she said, I went to the GP and he said the only cure was to prick every spot with a needle and squeeze out the contents. As you can imagine, this isn't an option with a 3-year-old child. I think that's quite right too. It's pretty barbaric when you think of it, but I'm ashamed to admit I've suggested this myself on occasion, because there's nothing that treats molluscum. I don't know what it's like in India, but certainly in Australia, there's nothing in the pharmacopoeia other than imiquimod and other very toxic substances that I wouldn't dream of putting on a 3-year-old kid. There's no treatment for molluscum, but don't worry, it will disappear by itself in about 2 years. That's what I used to say, and that's what they're still saying. Let's face it, it might not be threaten the patient's life, but it can significantly alter the dynamics of a family. I first used wheatgrass extract on one of my own children, who was covered in them. And my wife, who was a nurse, I said, put it on, but I said, it's not going to work. But it did. About 3 or 4 weeks later, the rash had completely disappeared. And that's why we now have this, because we use this for treating molluscum and patients all around the world. And we have a lot of feedback from very happy mothers. And they've successfully ridden their children of this harmless condition. And now some of them are actually informing their GPs, and very, very slowly in Australia, the GPs are starting to recommend it, because I know how they feel. Mum brings the child in and you look at the rash and they say, you just say there's nothing you can do. And really, is anyone here can cure molluscum? No, okay, I feel better now. And this is an aftermath of a treatment for molluscum, and these painful burns in a 2-year-old child erupted one day after treatment with cantharone for molluscum. It's a cantharidin, as you know, is a highly toxic poisonous substance extracted from beetles, and they use it for killing the wart virus. It looks like they use it for killing the child as well. I personally believe it should be banned and relabeled barbaric. Some dermatologists attack these children with knives, liquid nitrogen. They burn them. They do all sorts of things. And the screaming child wrapped up in a blanket, shut up kid, or I'll, belt you. I mean, this is dreadful. And so we're a little bit more subtle. And we probably I don't have any studies, but probably about 70% or 75% of these kids just get better. And it takes maybe 4 to 12 weeks. It varies a lot. But anyway, this is the anti-inflammatory sort of response you see. You can see the molluscum, see these things, brown spots here. So they put this stuff all over the kid's skin and burnt it to a frazzle. And but after 9 days of putting the wheatgrass spray on it, the child's recovered, and the mollusca are disappearing anyway. But it demonstrates the anti-inflammatory, the effect of wheatgrass. Alopecia areata doesn't work too well that I've come across in adults. I've probably had 1 or 2 over the years, but kids, I think they've still got the dormant hair follicles. I think it's and this is why I think there's a growth factor element here, and you're activating these growth factors which stimulate the hair follicle, and in time the hair grows. It takes time. It takes perseverance. The mother of this child, 5 years, she's spent a fortune going to dermatologists. She even took the kid to Europe with a special doctor to get a specialist dermatologist who could cure alopecia, but didn't succeed. This child was in the United States. The grandmother persevered with the spray, and the child got his hair back. So here's another case of possible growth factor activation or immune plus or minus immune modulation. And this 35-year-old surgical nurse developed severe nail damage caused by frequent hand washing, then treating the subsequent periungual dermatitis with topical steroids for 12 years. It's quite a common condition, as I discovered. And she became totally steroid dependent and gave up trying to stop them. And using the wheatgrass extract, I was able to stop the rebound and gradually cease the steroids. This is what I do. I've done this on thousands of patients, literally thousands of patients with severe eczema who have been steroid dependent. And what I do, I use the grass in combination with the steroid over a period of 2 or 3 weeks, and I gradually start to reduce the steroid. And the rebound comes, and the wheatgrass counteracts it. I come down step by step. It might take me 3 months or 4 months, but I get there. And I have had very, very few failures, and I've had some, severe, very severe cases of eczema that have recovered. So at 8 months, the